Myth: teens don't suffer from real mental illness, they are just moody. Fact: yes, it can sometimes be difficult to differentiate between symptoms of a mental health disorder and typical teenage behavior, but just because a symptom or a behavior is common does not mean that it can never signal a deeper problem. Most teens will have moments of moodiness, sadness, and problem sleeping, and most of these teens will never need treatment for a mental illness. But for teens whose symptoms are severe enough to disrupt their lives, the problem is not a normal part of being a teen. The problem is mental illness.
Myth: kids can't have mental illnesses like depression. Their emotional problems are just part of growing up. Fact: even children can experience mental illnesses. In fact, many mental illnesses first appear when a person is young. 1 in 5 children and adolescents has a diagnosable mental illness, and for 1 in 10, the illness is severe enough to cause impairment. Early identification can significantly improve quality of life. Mental illnesses may look different in children than in adults, but they are a real concern. Mental illnesses can impact the way young people learn and build skills, which can lead to challenges in the future. Unfortunately, many children don't receive the help they need.
Myth: it is just a phase, you'll grow out of it. Fact: mental illnesses do not magically vanish once an individual reaches a certain age. In fact, failing to get proper treatment in the early stages of a mental health problem puts a person at risk for more severe outcomes, like more severe symptoms and the temptation to engage in unhealthy coping techniques, such as substance abuse or self-harm. Ignoring the problem may only make things worse.
Myth: mental illness is a sign of weakness. Kids did not have all these mental health problems back in the day. Fact: just like any major illness, mental illness is not the fault of the person who has it. Teens were less diagnosed in the past than today because of increased awareness, advanced diagnostics, and a greater understanding of the true nature of teen issues. Like in medicine, diagnostic tools have improved.
Myth: youth who are suicidal are only seeking attention or trying to manipulate others. Fact: efforts to manipulate or grab attention are always a cause for concern. It is difficult to determine if a youth is at risk of suicide, and all suicide threats must be taken seriously. They do not necessarily want to die. They want their pain to end. If their ability to cope is stretched to the limit, or if problems occur together with a mental illness, it can seem that death is the only way to make the pain stop.
Myth: teens are faking it or doing it for attention. Fact: no one would choose to have a mental illness, just as no one would choose to have a physical illness. The causes for mental health conditions are intensely studied and they are real. For anyone living with a mental health condition, their specific symptoms may not always be visible to an untrained observer. It can be challenging to relate to what people with mental health conditions are going through, but that doesn't mean that their condition isn't real.
Myth: it is hopeless. Fact: teens with mental illness are not lost causes. Mental illness is not evidence of a core character deficiency. It is an illness that can be treated with medication and therapy. Young people should not be criticized, punished, or excluded for behaviors that are actually symptoms of treatable mental health disorders.
Myth: talking about suicide will give a young person the idea or permission to consider suicide as a solution to their problems. Fact: talking calmly about suicide without showing fear or making judgments can bring relief to someone who is feeling terribly isolated. A willingness to listen shows sincere concern. Encouraging someone to speak about their suicidal feelings can reduce the risk of an attempt. Stigmatizing talking about suicide may prevent some people from talking openly about the pain they feel or the help they need.
Myth: bad parenting causes mental illness. Fact: no one factor can cause mental illness. Mental illnesses are complicated conditions that arise from such things as genetics, biology, chemical imbalances, prenatal exposure to drugs and alcohol, environment, and life experience such as stressful events. Although a poor home life may exacerbate a mental illness, it does not cause it. Family members and loved ones can, however, play a big role in support and recovery.
Myth: having anxiety is not a big deal. Fact: because some adolescents think that it is normal to have to manage a large amount of stress and anxiety, they often don't say anything. Anxious kids most often just internalize an anxious experience. They don't raise flags or cause anyone grief, so they may not receive proper treatment. Furthermore, anxiety in adolescence can very easily lead to substance use, depression, and other mental illnesses.
While we may think of low mood or other challenges as adult problems, they can affect people at any age. Children and teens can experience mental illnesses like depression. Sometimes it can be difficult for adults to understand how difficult children's problems can be because we look at their problems through adult eyes. But the pressures of growing up can be very hard for some children. It's important that we remind ourselves that while their problems may seem unimportant to us, they can feel overwhelming to young people.